Hey all, it's Vanessa Love. So glad that you're here to join me. All right, so I wanted to talk about reactive attachment disorder, or RAD, and I wanted to talk about it in adults. So basically, if a person has not formed a good relationship with one of their parents before the age of 5, or a caregiver before the age of 5, it will be very difficult for them to do a lot of different things, including having friends. So I've been doing some research about this, and what I'm finding very tough to find is any research about what it is to have RAD as an adult. What's happening is that a lot of the literature, even as I'm reading this, it talks about the child as so severely neglected, or not being offered basically connection, that they're stunted. But it doesn't say anything about what will happen to someone who does not get help with this, because this is one of the very important things, that if they're not being helped as a kid, if there's no, sense that like this could be an issue, it's never addressed, then they will have problems as an adult. There's no doubt about that. Like, you don't just like go, oh, I don't actually have that. Like, I know my mom didn't care about me and, like all of my life, but like, I'm fine now. It doesn't work always that way. Like, people find it very tough to have connection to other people. So diagnostic criteria, a consistent pattern of, I'm just going to skip over a lot of these things: emotionally withdrawn behavior towards an adult caregiver or a person around them. And the person rarely seeks comfort when they're distressed, or when like, even if like someone's like, oh hey, how's it going, you look a little sad, like they don't even want to like give into that. There's so a persistent social and emotional disturbance, with minimal social, or with two of the following: minimal social and emotional responsiveness to others, and limited positive affect, which means like not a lot of smiling, or like even frowning. Like, if it's not a positive affect, there's nothing added to their face. So they always just kind of like look very just plain. And episodes of unexplained irritability, sadness, or fearfulness that are evident during non-threatening interactions. I brought this up to one of my clients, and she said that she eats lunch alone because she doesn't want to be bothered. Not a threatening situation, but she's like, man, I don't want to be bothered. And so, like, this is also the child has experienced extreme and insufficient care, and it says like as evidenced by all of these things. And like the criteria for autism is not met. The disturbance is there before the age of 5, and the child has developed at least 9 months. So this is between 9 months and 5 years that like the kids have to like have that connection to a caregiver, and if they don't have it, then it's very difficult for them. And so I'm like reading some of the stuff about this, and you do have to differentiate between autism spectrum disorder, intellectual disability, and depressive disorders for kids. And it does, because so comorbidity is like, so things that happen at the same time, conditions associated with neglect, of course, cognitive delays, language delays. It says stereotypies. It means like stereotypic behavior, where like, let's see. Actually, I don't know what that one is, because I know like non-stereotypic behavior. Oh, stereotypic behavior is the repetitive behavior in autism. So yeah, it would look like autism, but it's not. And depressive symptoms may also co-occur with this. But they're saying that most of the time it is like it's rarely seen in clinical settings, and it's rarely seen in populations of severely neglected children, that it's only 10% of children. I don't know if I agree with that, because like I was just reading something that said something completely different. That was like, as adults, like kids can, the RAD kids might like develop personality disorders like narcissism, borderline personality disorder, antisocial personality disorder, which is not what you think it is. Just because you don't want to be outside and socialize does not mean that you have antisocial personality disorder. Antisocial personality disorder is also, sociopaths and psychopaths. Like, you're not that, right? Okay, usually people aren't. But I hear antisocial so often that I'm like, I get what you're saying, it's not the same thing. That like a lot of the kids who are in foster care have been do qualify for this. And I'm like, well, yeah, I mean, and adopted kids, this is my specialty. And like, because of severe trauma, like I see adults who have been adopted. I've seen adults who have been in the foster care system, and like, they definitely don't trust. They don't get close to people. It's part of PTSD, but it's also a part of the attachment. Like, it's so hard to separate them, because when you have a parent that's neglectful, you're obviously going to have trauma, but like, you're also going to have difficulty like connecting to other people. Definitely getting close. And I've read stuff from Bessel van der Kolk that says that like, when someone is traumatized at such a young age, traumatized in general, actually, whenever they see someone who is a stranger, their brain goes danger, instead of like a normal brain would be like, oh, person who I don't know yet. Hi, how are you? I don't know if you're dangerous, like approach reluctantly instead of never approach at all. And I think that's important. So I was actually reading about, that's not the one that I was reading. I was reading from Quackwatch, because I was like, okay, so I mean, it seems like the recommended therapy for this would be attachment theory. And they're like, ooh, you better watch out for attachment theory. Be very wary of that, because some of this stuff like makes sense. Like, I'm like, okay, I see where you're coming from. But then like, they're like, okay, so this is why you don't want to do that. Unfortunately, there are people in all aspects of the therapy community who are completely off the wall. And I wish that I didn't have to say that. But I just read something about a person who has been a therapist for 35 years, and he had the most terrible boundaries I have ever heard of. Like, his client called him and was like, hey, could you go over to the house? Because I have a contractor coming. Like, I'd be like, no, I have clients today. I don't know you like that. That's not something that you can ask me. And I don't know, he did in-home therapy with this family and felt totally comfortable going over there and meeting the contractors, which I'm like, I don't. And then he got in trouble for some inappropriate things. So I'm like, like, you're a jerk. I can't even process what this news story is about. And you have been a therapist for this long and don't know boundaries. So like, it happens in every aspect of this career. It's so unfortunate, because it's like, expletive, that happens. It happens. This sucks. Okay. So they're saying, okay, attachment theory has 4 core characteristics that clash with general accepted principles of psychological practice. 1, the belief that a child must express rage that is within himself or herself in order to improve. Attachment theory, attachment therapy holds that negative emotions of a child must be released in order for a child to function normally. And I'm like, oh, I could see how that works. Yeah. The children with RAD won't learn to love until they can release the anger, the helplessness, the hopelessness that comes from early experiences. Okay. Let's see. And they said, interestingly, the same practitioners do not caution their parents against excessive happiness and fear that they may run out of joy. The same practitioners do not caution. That's an interesting one. Okay. I mean, like, I can see where that is because, like, you know, like, you do have to kind of run the gambit, to get that out. I'm like, ooh, I agree with this crap. Oh no. Informed consent. Says, as used in attachment therapy is a mockery of the term as used elsewhere. Ordinarily, when a patient consents to treatment, they stop if they change their mind. But in attachment therapy circles, if the patient asks for treatment to stop, the therapist interprets this as resistance for which the level of intervention must be increased. Which I'm like, ooh, that does seem like that would be an issue, but like also you guys are coming at it from like this way that's like, we don't like this. This is very much it's not even a cautionary tale. This is like, watch out for these people, which I'm like, I mean, I think, you know, especially when kids are in therapy, they should be at least informed. And like aware. And there is a part of me that I'm like, knowing RAD kids, I'm like, yeah, you know, like I would interpret it as resistance because like people know how to run away and these kids know how to run away. So like, why wouldn't you be like, I think this might be a resistance. You don't want someone to get close to you. But I do understand where that would be like considered just not good practice because like it almost makes it seem like they're forced into this situation and then they're forced into continuing into therapy when it doesn't feel good for them. And, you know, like sometimes therapy doesn't feel good and sometimes you want to run away and sometimes you want to cry for like 5 days. When one could argue very persuasively that touch, such as a hand on shoulder, a brief hug, may be therapeutic. Attachment therapy practitioners take the use of touch to new levels. In one case outlined in his book, Ken Majid tells of a young child being forced to undergo a 3.5 hour session, which included 6 experienced body holds, which is usually like something like this. Because you can do that with like a child's body when they're tiny. I wonder what his reasoning for that was. That sounds very odd. Attachment therapy practitioners regularly tell children what they're feeling based on the therapist's belief rather than the child's. Indeed, a parent whose child was treated at at some clinic, when we saw with Tina, what we saw with Tina is they went to the rage telling her why she was feeling the rage. And that was on Oprah. And I think this is one of the ones where like